Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
We always hear that getting married is good for you, right? Like it's supposed to help you live longer and be healthier overall.
Yeah, having that partner by your side, all those benefits we always hear about.
Well, there's this new study that followed people for like 18 years, and it found something kind of weird. It actually linked marriage to a higher risk of dementia later in life.
Oh, wow.
Yeah, kind of makes you think twice, huh?
It really does. I mean, we've always kind of thought marriage was good for your brain, like it helped protect against cognitive decline.
Yeah, exactly. So when something like this comes out, it definitely throws a wrench in things. And that's why we're diving into it today. We're going to unpack this new research on marital status and dementia risk in older adults.
Really get to the bottom of it.
Exactly. We've got a couple of sources to help us out here. A health news article that summarizes the study, and then the original scientific paper itself, which was published in Alzheimer's and Dementia.
So we're going straight to the source.
Absolutely. So our mission today is to break down what the study found, how they did it, and what it all means for you.
Right. We want to go beyond just the headline.
Yeah.
What were the researchers actually trying to figure out? How did they do their research? What did they find? And maybe most importantly, what could these findings mean for how we think about aging and relationships?
Yeah, we definitely want to look at the limitations of the study, too.
Absolutely. And what the experts are saying about it all.
So let's get into it. What exactly were these researchers trying to find out in this 18-year study?
Well, the main goal was to look at the relationship between different marital statuses and the risk of developing dementia as people get older.
So like married versus not married.
Exactly. They looked at people who were married, widowed, divorced, and never married.
Okay, so 4 different groups.
Yeah. And they specifically wanted to see if there was a connection between which group you were in and your chances of getting dementia.
Gotcha. And the researchers mentioned that past studies haven't always been clear on this, right?
Yeah, they pointed out that the findings from earlier research have been kind of inconsistent, so they were hoping to clear things up a bit.
All right, so how do they actually carry out this research? What did they do for 18 years?
So this was a longitudinal study. That means they followed the same group of people over a long period of time, 18 years in this case.
Okay, I've heard of those.
And they had a lot of people involved, over 24,000 participants. None of them had dementia when the study started.
Wow, that's a lot of people. Where did they find all these people?
These participants were recruited from 42 Alzheimer's disease research centers all across the U.S.
So a pretty big study then.
Oh, yeah, definitely. All these centers were feeding their data to the National Alzheimer's Coordinating Center.
So over 18 years, what kind of stuff were they collecting from these participants?
Well, every year, these participants would have a thorough clinical evaluation.
With a doctor.
Yeah, by trained clinicians. And they use standardized procedures to assess each person's cognitive function.
Basically checking how well their brains were working.
Exactly. And they wanted to see if anyone developed dementia or even milder forms of cognitive impairment, like mild cognitive impairment.
They followed all these people for that long.
18 years, can you believe it?
Yeah.
They gathered a ton of data, over 122,000 person years worth.
Wow. So at the beginning, when they were sorting everyone into those marital status groups, how exactly did they define each one?
Well, it was pretty straightforward. They recorded each person's status at the start: married, widowed, divorced, or never married.
Makes sense.
Now, there were a few people who were separated, and they were included in the divorce group.
Okay.
And anyone who was living with a partner but not officially married was counted as married.
I see. Why did they do that?
Mainly because there weren't that many people in the separated or cohabitating groups, so it made more sense to combine them. And the married group was their main reference point for comparisons.
All right, that makes sense. So they had all this data on people's marital status and their cognitive health over time. How did they go about actually analyzing it all to see if there was a connection?
Well, they used this statistical method called Cox proportional hazards regression.
Never heard of that.
It's a pretty common way to analyze the time it takes for a specific event to happen. In this case, the development of dementia.
Makes sense.
And importantly, they adjusted their analysis to account for other things that could also influence a person's risk of dementia. They didn't want to just assume it was all about marital status.
That's smart. So what kind of other factors did they consider?
Tons of stuff. They looked at age, sex, physical health, mental health, lifestyle factors like smoking, genetic risk
A
factors.
family history of dementia and stuff?
Exactly. One specific gene they looked at was apolipoprotein E epsilon 4.
What's that?
It's a gene that's been linked to a higher risk of Alzheimer's disease.
Oh, okay.
They even factored in things related to how participants were referred to the clinic and the type of evaluation they received.
Wow, they thought of everything. So after all that data gathering and number crunching, what did they find? Did they uncover any interesting patterns?
They sure did. The big picture was pretty fascinating. Out of all the participants, about 20.1% were diagnosed with dementia over those 18 years.
Okay, so roughly 1 in 5 people.
Right. But when they broke it down by marital status, some interesting differences emerged.
I bet.
Almost 22% of the married folks developed dementia.
Okay.
And the same was true for the widowed group, about 22%.
Interesting.
But now listen to this. The rates for divorced and never married people were way lower.
Really? How much lower?
Only about 12.8% of divorced individuals got dementia, and around 12.4% of never married folks.
Whoa, so like way less than half the rate of the married and widowed groups.
Exactly. That's a pretty huge difference. And it really makes you think about that assumption that being single somehow makes you more susceptible to cognitive decline.
It really does. What else did they find?
Well, they went even deeper using those hazard ratios.
Remind me, what are those again?
Think of it as a head-to-head comparison of how likely each group was to develop dementia. And what they found was pretty striking. Divorced and never married people consistently showed a significantly lower risk compared to married individuals. And this was after they adjusted for all those other factors we talked about, like health, lifestyle, and genes.
So it wasn't just because they were healthier or younger or whatever.
Right. And the widowed folks initially seemed to have a lower risk too, but that link weakened and wasn't statistically significant once they fully adjusted for all the variables.
Fascinating. Did they look at specific types of dementia as well?
Yeah, they did. In the initial analysis, all 3 unmarried groups, widowed, divorced, and never married, showed a reduced risk for both Alzheimer's disease and Lewy body dementia. But after adjusting for all those other factors, the lower risk was still there for divorced and never married individuals when it came to Alzheimer's disease.
But not for widowed people.
Right, not for them. And for Lewy body dementia, the lower risk only remained significant for the divorced group after the adjustments.
Gotcha. What about other types of dementia?
They didn't find any consistent link between marital status and vascular dementia or frontotemporal lobar degeneration after adjusting for everything.
Interesting. So it seems like the link with Alzheimer's is the strongest. What about those people who already had some mild cognitive impairment at the beginning of the study?
Good question. The study actually found that divorced and never married individuals were less likely to progress from mild cognitive impairment to full-blown dementia.
Really? That's pretty significant.
Definitely. It suggests that whatever is going on here might also influence how quickly mild cognitive issues worsen.
Were there any specific groups where these patterns were particularly strong?
They did notice slightly stronger risk patterns among men, younger participants at the start of the study, and those referred by healthcare professionals. But overall, the associations between marital status and dementia risk held up across most subgroups.
So this wasn't just a fluke in a small group or anything.
Right. It seems to be a fairly consistent pattern.
Okay, so all of this is pretty surprising. What are some possible explanations for why they found these results? What do the researchers think?
Well, one idea they brought up was that dementia might just be diagnosed later in unmarried people.
Because they don't have someone noticing the early signs.
Exactly. They figured maybe spouses are more likely to pick up on subtle changes and push their partners to get checked out.
Yeah, that makes sense.
But the researchers pointed out that because they use regular standardized evaluations for everyone, that's probably not the whole story. Plus, the never married and divorced groups weren't diagnosed later or with more severe impairment than married folks, which kind of weakens this argument, especially when you compare those groups to the widowed folks who are diagnosed later and with more severe symptoms.
Right. If everyone's being checked regularly, it's harder to say one group is just being missed. What other explanations did they suggest?
Another intriguing idea was that maybe unmarried individuals have stronger social connections outside of marriage.
Like with friends and family and their community?
Exactly. The researchers suggested that these folks might be more involved with friends, neighbors, community groups, things like that.
Yeah, I could see that.
And they also thought maybe unmarried people are more likely to engage in healthier behaviors, which could help protect their brains.
So it's not just about having any close relationship, but maybe about the type and number of connections you have?
That's a really interesting point. They brought up marital quality too.
Oh, yeah, that makes sense.
They referenced other research suggesting that the benefits we often hear about, like the health benefits linked to marriage, those might only apply to good marriages.
The happy ones.
Right. People in unhappy or strained marriages might actually have similar or even worse health outcomes compared to unmarried folks.
Wow, that's something to think about. So basically, a rocky marriage might actually cancel out any of those supposed benefits.
Exactly. It all comes back to stress.
Right. And the researchers also pointed out that the findings for specific types of dementia suggest that vascular problems might not be the main driver here, since there wasn't a significant link between marital status and vascular dementia.
So it's likely something else entirely.
Right. Fascinating stuff. So these results really do challenge that whole idea that being unmarried automatically puts you at a higher risk for cognitive problems as you age.
Yeah, it kind of flips that on its head. And because of that, the researchers suggest that public health efforts and aging research need to reconsider this assumption that unmarried older adults are inherently more vulnerable to dementia.
And maybe start focusing more on the positive things that might protect unmarried people.
Exactly, like what helps them stay sharp and engaged.
This is all super interesting, but of course we have to consider the limitations of any study. What were some of the potential drawbacks of this one?
Well, one thing to keep in mind is that most participants were recruited from Alzheimer's disease research centers. They either volunteered or were referred by a doctor.
So they were already concerned about their brain health.
Right, which means they might not perfectly represent the general population.
I see. So it's hard to say if these findings would apply to everyone.
Exactly. The researchers themselves mentioned this. They also noted that the majority of participants were white and married, with fewer Black and unmarried individuals.
So the group wasn't very diverse.
Right. And that means we have to be careful about applying these findings to other groups.
Makes sense. What else?
Well, because of those limitations, the researchers emphasized that more research is needed.
With different kinds of people.
Exactly. They specifically called for more research with diverse populations to really nail down the specific ways marital status and dementia risk are connected. They also suggested looking at socioeconomic factors beyond just education level, as well as the impact of relationship quality and the duration of someone's current marital status after a change, like divorce or widowhood.
So while this study gives us some food for thought, it's really just the beginning of the story.
Absolutely. And it's always a good idea to hear what the experts, in this case the researchers themselves, took away from their work.
What did they say?
Well, their main takeaway was that unmarried folks, especially those who were divorced or never married, had a lower risk of developing dementia compared to those who stayed married. They emphasized that this connection was still there even after accounting for all those other factors, like demographics, health, lifestyle, genetics, and referral source.
So they were pretty confident in their findings.
Yeah, seems so. They also highlighted that Alzheimer's disease and Lewy body dementia were more common in the married participants.
Right, we talked about that.
And the risk of progressing from mild cognitive impairment to dementia was higher for married individuals, too. On the other hand, they didn't find a link between marital status and vascular dementia or early-stage cognitive decline in their fully adjusted models. And those patterns were generally consistent across different groups.
So even though the researchers called these findings surprising, it seems like they were pretty solid.
Yeah, their paper even mentions surprising findings right in the title. It's interesting because this research contradicts some previous studies that suggested being unmarried increases the risk of dementia.
So a lot more to learn, right?
Exactly. The researchers called for more work to understand the underlying reasons behind these connections and to see if they hold up in more diverse groups of people.
So after this deep dive, what's one thing our listeners should ponder as they go about their day?
I think it'd be interesting to consider how this information might shift their perspective on relationships and health. How does hearing about this study change their thinking about the potential cognitive health journeys of themselves or their loved ones based on whether they're married or not?
Yeah, it really makes you think. And it highlights that the connection between our social lives and our health is more complicated than we might realize.
Absolutely. And if folks want to learn more, I'd suggest looking into the research on those social and lifestyle factors that can help support good brain health, whether someone is married or not.
Yeah, things like staying social, eating well, exercising, managing stress, all that good stuff.
Right. Those things can benefit everyone, regardless of their relationship status.
So it's not about saying marriage is bad or anything like that, but rather recognizing that the relationship between our social lives and our brains is complex and still being explored. The key takeaway here is to focus on overall well-being, which means nurturing strong social connections, however they exist for you, and building healthy habits no matter what your marital status is.
Couldn't have said it better myself.
All right, everyone, thanks for joining us for this deep dive. Until next time.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.